Okay, let's move on as we continue on this Sunday morning Sports Medicine Weekly. And Dr. Cole, this is great. We've got a great guest on the line with us. You, of course, Dr. Cole, are the head team physician for the Chicago Bulls. And right now we're going to bring on Dr. R.J. Williams. He is the medical director, head team physician for the Brooklyn Nets and also the New York Red Bulls of Major League Soccer, also the head team physician for USA Basketball and the Iona College Department of Athletics. So kind of some nice symmetry here, Dr. Cole, and a gentleman that you go back a long way with, right?
Riley and I were residents together and have sort of had very similar paths and interests professionally, and are most importantly friends and colleagues. And he's a great doctor and a great guy, and I'm really glad that he's agreed to join us this morning. And it'll be really interesting to hear what's going on in New York, maybe in comparison to what we're seeing in Chicago as well. So Riley, thanks for joining us this morning.
Thank you. Thanks for having me. And again, I'll just reiterate, I think, Brian, you and I did our first night on call together, and I just remember feeling wholly inadequate after the weekend was over. So thank you for lighting the fire into me at the beginning.
It wasn't easy, but it worked out great for everyone.
Yeah, hey, Dr. Cole, take me back to those days with Dr. Williams and what that was like for you guys. You were younger surgeons, obviously, and what's changed? And you remember any specific cases or anything that in comparison to how they would be treated these days?
Well, I would just, I'll reflect back to a case that sort of got me interested in cartilage, and it was at Special Surgery which is in New York, and where Riley's on staff there, and. At that time, Steve, we would have individuals who would have cartilage problems, that they would start to lose cartilage in their joints, couldn't participate in sports, and we would simply put a camera in and sort of shave things up and clean it up. And a ton has happened since then. So I'd love to just throw it back to Riley. When you think back to those days as residents, Riley, we were pretty helpless. We didn't really have a lot in an armamentarium to make people feel better, and whatever we did maybe would sort of temporize it. Think back, fast forward. What do you think about that same patient? What do you do now compared to what we just didn't have available, 23 years ago?
Yeah. Well, I agree. I just think of it, Brian, and we all romance our youth a little bit. I just thought of it as a really intellectually stimulating kind of magical time because we didn't have the internet, right? So informational exchange was not as free and fluid. And let's face it, we were being told at the time to kind of do bad surgery. The diagnostics were bad. I mean, right now MRIs helps us to treatment plan, and back then you didn't really have that. So I think both of us were sort of lucky. Cartilage in particular as a subspecialty really started when we were both in training in the 90s with the, ACI procedure. And I think, that phenomenon, the interest at the time that we could somehow do better is what really, at least I see as very parallel, quite frankly. Certainly, I think, pushed us into that direction, as well as a love of sports and wanting to be sports medicine physicians, right? Totally crucial economically for our athletes to be able to continue to play, right? And we see ourselves now helping guys stay economically viable later into their careers.
Okay, I'm visiting with Dr. Riley Williams, orthopedic surgeon at the Hospital for Special Surgery in New York, also the head team physician for the Brooklyn Nets and the New York Red Bulls of Major League Soccer. I'm Steve Kashul with Dr. Brian Cole, and Dr. Cole and Dr. Williams worked together more than 20 years ago. So let me take you both back, gentlemen, again, when you first did different things with cartilage repair, and now you have different material to work with, and human tissue in that. And what is that like, Dr. Williams, compared to what you had previous before the cartilage transplant? Yeah,
well, the main thing was, we didn't have a big ability to plan, so surgeons were sort of handcuffed a little bit, and there was a procedure back then that was very popular, the microfracture procedure, which was really being practiced by all of the big sports medicine names at the time, John Bergfeld, Dick Stedman, Russ Warren and such, and we were lucky to have trained with a bunch of those guys. And the long and short of it is, when I started practice, I just found the results of that procedure left me wanting. My clinics were, in general, unhappy places. And right around that time, there was a company, I believe, called CryoLife, which was able to commercialize the transplantation of whole tissue or osteochondral allografts, which I know, Brian, I'd love to hear your perspective. It really changed my life in terms of patient satisfaction and happiness all around. It was like really eye-opening for me to do a surgery and then within a matter of weeks and months have patients be happy with me, because that's certainly prior to my personal use of those donor allograft tissues, that certainly wasn't the case.
I would agree. I think things have, we've sort of had different philosophies over the years about how we decide and when do you put your first and best foot forward. And these are things I've actually, even learned from you over the years, that I think that it takes, Steve, one of the advantages of being at sort of an academic institution where, we practice, we can actually collect outcomes and data, we can look at things very critically, and there's what you sort of believe based upon what you think you're seeing, and then what's really happening when you have the opportunity to look at things objectively. And as Riley was pointing out, probably the most reliable solution we have now to treat someone who fails sort of the simple stuff when they want a definitive solution is a cartilage transplant, is using a fresh graft. And the company he talked about was this CryoLife, where they used to sort of cryopreserve grafts, and now the grafts that we use are really fresh grafts. These are, as we've talked about many times, these are donated tissues that are kept in a prolonged cold environment, that it's not like an emergency like a heart transplant, but we have 24 to 28 days and sometimes longer depending upon who we use to actually get the graft in place. But the take home is that what we know now, we really didn't know then. And I think we're far better because we've taken a very critical look at how we can make good decisions for our patients. And that's where data, like you always hear how data is king. This is where data in our lives really makes a difference, because there's things we think and we believe, and then when you start to look at the data and look at it honestly and challenge yourself, you start to really see that we can make what we call evidence-based decisions, and not just based on our gut or what we think we saw over the last few years. And that's a really important thing to sort of acknowledge. We change what we do on a pretty regular basis based upon science and not necessarily just perception.
Again, visiting with Dr. Riley Williams, orthopedic surgeon at the Hospital for Special Surgery in New York, also head team physician with the Brooklyn Nets and the New York Red Bulls Major League Soccer, and also for a head team physician for USA Basketball. So let's turn to basketball then, Dr. Williams. What are some of the most common injuries you're seeing in basketball? I'm sure very similar to what Dr. Cole sees.
It really, Steve, you're talking about the pro level. I think our current conversation is very germane. You see a lot of wear and tear issues in players, certainly, I'd say mid to the late in their 20s, and oftentimes you're sort of faced with the decision: do you try to do a big reconstruction that is going to take months to years to get better from, or can you kind of manage them along, if you will? I just want to hop back a little bit. Brian talked about data, and it's Brian. I'm going to tell you, it sounds like the Mutual Admiration Club, but we had no prospective registries when you and I started practice, and now you look around the country, it's fairly standard to have prospective longitudinal studies in and around these procedures we do to help drive decision making, which is largely assumed now, and it's just nice to be here, chatting with you about it and sort of reflecting on how far we've come. In that vein, Steve, and I'd love, Brian, to hear your thoughts on it. I think we're at a similar inflection point with the biologics, right? Because I'd say 10 years ago I was all about these grafts, right? Doing these transplants and transplanting cartilage. I was a man and doing these surgeries, and now with the biologics, I find myself kind of rethinking these larger reconstructions, especially in these elite basketball players who are so dependent upon a quick return to sport with regards to their efficacy, in terms of maximizing their college years and/or eventually being professionals. Brian, where are you at with the biologics? Is it kind of part of your now?
I think Yeah, sorry to interrupt. I think you're right. I think what we've realized is that we, all of us, are trying to do the least amount necessary to get an athlete back to play, especially because some of these things have particularly long timelines. So biologics, ways to sort of trick our bodies to feel better, really in essence what we're trying to do is get people to feel better. And sometimes it doesn't take a stick of dynamite, and you can do it with things that are lesser. So, we're both, very accustomed to trying various things. There's nothing we do, Steve, what we talked about that sort of regenerates things by just providing an injection. But there are lots of things we do that actually can eliminate or reduce pain and improve function. And athletes kind of learn that they can actually play in pain to a certain degree. So using things like platelet-rich plasma, which we've talked about before, and maybe a source of stem cells which provide growth factors, not necessarily regenerate, like bone marrow and fat and so forth, all of that's become mainstay in how we treat things. So that's been a big addition to the things that surgeons used to always love to talk about, which is, fixing something and using cutting, fixing, pounding, and so forth. There's a lot of other things now that add this sort of finesse that we can help our athletes, and it doesn't necessarily always require surgery, or it can be used as an adjunct to surgery to make surgery better. And
Dr. Williams, while we have you on the line, as we close out our segment here, in our segment before having you on here on this Sunday morning, we talked a little bit about Kevin Durant and the torn Achilles. Is that injury, in your opinion, one of the most difficult to come back from?
Well, I think, listen, anecdotally, yes, and in terms of the little bit of literature that's out there, I think it's proven that there is an effect on athleticism, explosiveness, speed, etc. It's just hard not to, right? I mean, especially in the game of basketball, you talk about wing players, sort of 1 through 4 on the floor. So much of the modern game is predicated on creating space and getting by guys, and undoubtedly you do lose a little bit of that sort of ability to eccentrically load the tendon, because your whole body weight goes to that tendon and more. So, listen, it'll be an interesting exercise this season to see how our guy does. I mean, he looks great, up to the minute. Definitely, I think, benefited from the kind of extended period of rehabilitation. But you know what? It's a big question mark. I don't think we have a whole lot of data-driven analysis to really let us know, kind of who in terms of height, size, position, age, all that stuff, like who's going to do well and who's not going to do well.
Okay, great stuff. Dr. Riley Williams, orthopedic surgeon, the Hospital for Special Surgery in New York, also the medical director, head team doctor for the Brooklyn Nets, the New York Red Bulls of Major League Soccer, and USA Basketball. Thanks so much, Doc, for joining us here and reliving your days working with my co-host, Dr. Brian Cole. It's great to have you on.
Dr. Cole, we call him, he's James Brown. He's the hardest working man in orthopedics, man. Keep it going.
I'm just here to learn, my friend.
All right, guys. Thanks for having me.
Thanks so much. Okay, we're going to take a break here on Sports Medicine Weekly. When we come back, it's one of our staples of the show, Ask the Doctor segment, giving our listeners the chance to have Dr. Cole address their specific sports injury issues. You're listening to Sports Medicine Weekly, only on
670 The Score.